Hi, my name is Gwen, and I'm a nurse and the founder of Jewell Nursing Solutions, a company dedicated to the prevention of injuries associated with acute patient care, especially pressure ulcers. I am also the inventor of the backbone turning wedge, the best turning wedge in the world. As you probably know, an essential part of good nursing care is to do what I like to call turn therapy. Turn therapy means that when a person is unable to easily move by themselves, they need to be assisted to move, to turn at approximately 30-degree angle. That angle, 30 degrees, is far enough to get pressure off the sacrum and coccyx area, but not so far as to put pressure on the hip, otherwise known as the greater trochanter. The reason we want to avoid these two areas is that the skin over these areas is very close to the bone, and when sustaining long-term pressure, the circulation gets cut off and they can get bed sores, or otherwise known as pressure sores, which are painful and expensive and hard to treat, so nobody wants that. The tricky part of turn therapy is not so much assisting the person to turn, it's keeping them near this 30-degree angle. You can try using pillows, which work for a little while, but the problem is trying to get that 30-degree angle. You can lean the person back again, but pillows have a tendency to squish down over time, and the person ends up right back on their sacrum in no time. Some people like to fold the pillow in half, which is kind of a little difficult to do. Certainly gives you a better lift, but I don't think we have the 30-degree angle anymore. As a matter of fact, I think she's on her greater trochanter again. A typical wedge may solve some of these problems, but as you can see, when you place the wedge firmly under the person, not only do you get direct contact with the sacrum, but the more greater angle will actually cause the person to be well over 30 degrees, and there's excessive force on the trochanter again. And the lateral force from the person's body weight actually pushes against the wedge to the side. So as time goes by, the wedge shifts and the person shifts, and eventually she's right back on her sacrum again. So pillows bottom out and wedges slip out. What are you gonna do? You're gonna get the backbone turning wedge. The backbone uses a uniquely crafted contoured shaping and symmetrically angled sides to provide the most comfortable and effective 30-degree lift as possible. The cover is a soft, skin-friendly, stretchable fabric. This medical-grade fabric is perfect for multi-patient use because it is antimicrobial, water-resistant, and breathable. Laundering is not necessary because you can wipe it clean with any institutional disinfectant according to your protocol, or you can even rinse it underwater. When you get the backbone turning wedge, you are getting a wedge that is designed to work. You get lift off the mattress at 30 degrees, no direct contact with the sacrum, no slipping, no twisting of the spine or hips, and no complaints. Let me show you how it works. It's easy. Using proper patient handling techniques and good ergonomic principles, have your patient turn as far over as possible on the side. Tilt the angle slightly so that you can place the top part of the cushion under the scapula here and the round part under the buttocks. Notice how the wedge will support the buttocks area, but the contouring will actually be away from the sensitive sacral coccyx area and actually away from the whole spine. As the patient turns back on the cushion, there, comfortable?
Yes.
You may want to check for a proper placement by slipping your hand under the wedge to feel and make sure that there's no direct contact with the sacrum and that it's got a little distance off the bed. Now I want you to notice when you look at this cushion that she is actually on top of the cushion and very near a 30-degree angle. She's not on the trochanter and not the sacrum. Now she's also on top of the wedge as opposed to being to the side of the wedge. The downward pressure is actually helping the wedge stay in place as opposed to a lateral pressure what a typical wedge gets. Now if that's not cool enough, watch what happens when I raise the head of the bed. Most people will have to have the head of the bed raised for things like eating and breathing, little things like that. Watch carefully what happens to the cushion as the bed goes up. What happened to the cushion? Nothing happened to the cushion. It stayed in place and she remained in her 30-degree tilt. You can still, of course, check to make sure that there's no contact on the sacrum, but the cushion is conformed such that it'll actually stay under her because it turns with her back. So even if she slumps down, she's still got the wedge under her and the wedge will go with her and keep the tilt. Now, I want to point out one last thing about the backbone that makes it the most powerful tool in your turn therapy toolbox. The backbone is a very versatile wedge and can be used for support in many other areas. For side sleepers that need a little hip support, you can place the cushion between the legs. Now notice here too that you actually even get some float for some of the bony prominences. Even the ankle is floated gently across the top of the skin-friendly surface that is providing even pressure distribution. For taller people where the feet keep pushing against the rail, you can use the backbone as a protective cushion. And if you have patients who have wounds on their feet or toes and require protection from the bed sheets, you can use the backbone as a bed skirt so that there's no direct contact with the feet. You can also use it as a head pillow. And who knows, the heel bone is so versatile, you can use it for things I hadn't even thought of. Would you like some milk with your tea?
Sure.
The Backbone Turning Wedge by Jewell Nursing Solutions removes pressure off the sacrum while lifting and supporting the person in a 30-degree position. It does this without coming into direct contact with the sacral area itself. It keeps the person's hips and spine in alignment. It won't slip out of place, even during head-of-the-bed elevation, shifting, or slumping, and it can be used to support in many other ways.
If you know somebody that needs to get the pressure off, don't wait. Order your Bedsore Rescue cushion today at www.bedsorerescue.com.